Hi everyone, this is Tim, your Block 3 Med-Surg lecturer and lab and clinical replacement instructor. And I thought I'd do a video voiceover for the calendars for Med-Surg for this semester. They're a little confusing, and I wanted to kind of spend some time going over them so that way you're not confused. I will tell you that my biggest tip or my biggest hint to you or my biggest advice to you would be to actually use either some sort of Google calendar or some sort of electronic calendar that kind of reminds you when things are due, so that way it doesn't turn into, oh my gosh, I didn't know, or I forgot, or I wasn't quite sure exactly what was due when. So anyways, the first calendar that I have up here is the lecture calendar. Lecture is every Monday and Tuesday, as you know, and I've already sent out the Sign Up Geniuses. I purposely teach the same lecture twice on Mondays and Tuesdays, and the reason why is there's 28 of you, and it's easier for me to actually split you up into different groups and do a 7 to 9 and a 9 to 11 group. That way there's 14 of you. It's a little more interactive, it's a little more personal, it's a little more intimate in the sense of you guys feel more comfortable in smaller groups asking questions. I'm able to ask you a lot of questions, getting you to think like a nurse, getting you to think through the process of the nursing process, the AdPi stuff. So that's how and why I really do what I do for the lecture portion. If you look at the actual calendar, it says that January 17th is week 1, which it is, but that's the week of January 17th. So January 17th would be a Sunday, the 18th is a Monday, and Tuesday is the 19th. So when you look at the actual calendar, it shows that the week of January 17th, Monday, there's no class. I believe it's Martin Luther King Day. And then Tuesday, we actually will do an orientation, which I have a PowerPoint. It's the only PowerPoint you're going to ever get from me during lecture. I find that they're very boring, and I'd rather do more interactive stuff than to sit there and click through slides and just drone on and be boring. So that's for week 1. Week 2, which is the starting the week of January 24th, which is a Sunday. The 25th is a Monday, and the 26th is a Tuesday. We're going to do renal. That is everything from the UTI stuff to the end-stage renal stuff to the dialysis stuff. So for those 2 days, we're actually doing the renal portion of class. It also says that there's actually quiz 1. Quiz 1, 2, 3, and 4, which are highlighted in blue, those are going to be every Sunday night. So if you actually look up here where the where it says quizzes and Sunday is 2100 to 2130, it's through Exemplify. We're using Exemplify or exam software, whatever you want to call it. I'm going to do your quizzes through there. It's easier for me to be able to shoot them out to you. It's easier for you just to sit down and actually log on and actually do them. And then when you're done to them, they shoot them back to me and they're already graded. So it just makes it a little bit easier. That's going to be from Sunday from 2100 to 2130. So 9 to 9:30. That would be week 2, week 3, week 6, and week 7. Quiz 1 is going to be on renal stuff. Now, I know you're going to be like, well, we haven't had any lecture yet. How are you going to quiz us? You actually have had lecture. I do my PowerPoint voiceovers. They're already posted on YouTube. You have access to them. You have been able to actually listen to them and see them. You also have read your book. So essentially, I have lectured to you. You've used your book as a guideline and to be able to either concrete the information or to be able to answer some questions or read the book and then do the PowerPoint voiceovers to help answer those questions too. But your quiz 1 is going to be Sunday night on renal before the actual lecture. January 31st, the week of. Week 3 is quiz 2. Again, it's going to be on GI. It's going to be everything from upper GI, lower GI. It could be on pancreas, liver, or gallbladder stuff. I don't make the quizzes too hard, so don't fret over, oh my gosh, it's going to be this really long quiz and it's going to be very in-depth. It's not. It's really just testing whether or not you actually have read the book, done the PowerPoint voiceovers, and understand the actual information. My quizzes and even my tests are very situational based. I don't ask you questions that are knowledge-based because you all memorize everything that's in the book, memorize everything that's in the PowerPoint, you memorize everything that's in the voiceovers. But that's not the point that I'm trying to find out whether you understand. I really want to put you in a situation going, okay, you have a patient who's doing this, or you see this, or you're seeing labs that are doing this. What do you do with that stuff? That's what I want to know from you guys. On February 7th, which is week 4, you have Pass Point. This is highlighted in green, and there's actually one due week 4 and another one due week 8. I purposely put them in the weeks of your test. Pass Point is actually, compared to UWorld, Elsevier, it's really NCLEX based style testing or quizzing. It's not like PrepU. I found that you guys don't like PrepU. I don't even like PrepU. PrepU is very knowledge based. They're really wanting to know if you understand the information that was found in the book, which is great. But with PassPoint, it's more NCLEX based. They're putting you in situations. They're wanting to know if you understand what to do or what you would see or how you'd react to stuff. That's why I have you guys actually buy the program for PassPoint. PassPoint, if you look up here at the top, PassPoint is due every Tuesday at 8 a.m. I open it from January 17th, which is the beginning of the actual semester, to February 7th or 8th and 9th. So it's actually due on Tuesday. And I give you roughly 4 weeks to do it. It's actually, I wouldn't say it's in depth, but it's just based on how well you do. If you answer questions correctly, your mastery level goes up higher and faster. If you don't do well or if you miss some questions, it drops you back down. It's really close to the NCLEX. I'm doing it with the intent that it actually kind of gets you prepared for the NCLEX. It also gets you prepared for my test because, like I said, they're really situational based. They're very NCLEX question based. So again, it's going to cover renal and GI and prioritization, electrolytes and balances. It's going to involve some fluids. It's going to be all encompassing from week 1 to week 4. Then you actually have test 1, which is on Tuesday. If you look up here at the top, let's see here. Well, I didn't really do that, but test 1 and 2 is week 4 and week 8. Regardless of how I lecture or what group you're in from 7 to 9 or 9 to 11, all of you will take the same test at the same time on Tuesdays. I have to determine whether or not they're actually going to be online or in class, but they are through Exemplify or ExamSoft. So you've already had that before, so it's nothing new to you. It's just a matter of me finding out closer to that date where we're actually going to do it. I have a feeling that we're probably going to do it in class, but again, we're going to be 6 feet apart. Everybody has to wear a mask. Everybody, we'll put you in a situation where you're safe enough and far enough away from each other to be able to take that. So. Let's see here, February 14th, which is week 5. There's no class on Monday. I believe it might be President's Day. And then you have neuro that week, and then week 6, you actually have a quiz Sunday night from 9 to 9:30, and it's going to be on endo. We're going to probably end up doing DKA one day, and then all the other endo stuff on the next day. Week 7, again, Sunday night, quiz 4. Monday we'll do men's health. Tuesday we'll do hematology. March 7th, which is week 8, you have your cancer lecture on Monday. You have PassPoint due on Tuesday morning, and then you'll have to test 2 Tuesday with me, whether it's on campus or it's through, and it's going to be through Exemplify, but it's whether or not it's on campus or if it's actually at home. And then you have a spring break, and you'll flip, and you'll actually go to OB. All right, so let's move on to the next calendar, and the next calendar is going to be your lab calendar. Again, this is going to be on every Tuesday. I only do lab on Tuesdays. It's on Tuesday morning from 11:30 to 3:30. It is going to be with Hannah. Hannah is going to be your lab instructor. Again, the week of January 17th, which is a Sunday, the 18th is Monday, and then Tuesday is actually the 19th. We'll do IV skills, which is pretty much hanging fluids and showing you how the pumps work. January 24th, week 2, so that's the week of January 24th, so that'd be a Sunday. 25th is Monday, 26th is Tuesday. We're going to be in 842 and we're doing NG tubes. So the room is the room that we're actually in. The number in parentheses is how many students that are actually going to be in there. Don't worry about the numbers, just more worry about the actual room and what we're doing for that day. Hannah will reach out to you. She'll send you an email explaining to you pre-lab stuff, like whether it's reading material, watching a video, doing some sort of very simple quiz just to kind of see what you do know and what you actually have learned from the material. You'll come to lab. Lab is only 45 minutes long. You'll show up, you'll do the skill, and pretty much you go home. And I've already set out the sign up genius for you guys to be able to sign up for which time you want. On Wednesday is simulation, which is February 14th. And there's another one on March 7th, and then you guys actually have spring break. So, and I'll go more into detail with the Wednesdays on those two specific Wednesdays. They're actually part of your clinical replacement. And again, when I go through that calendar, it'll make a little more sense. So again, it's really more a week of, and then the week one, and what we're doing for that day. We do not have lab on test days. I find that I was used to doing it, and then nobody really cared about lab after you've spent 2 hours trying to take an exam that you thought was really hard. So, why put you through more torture? All right, so the next calendar is going to be the clinical replacement calendar. This is actually the replacement for what you would have had for clinicals. You guys already did this in block 2. I actually used to teach with Jerry, so I kind of know how she thinks a little bit, so I kind of know that this isn't really too far off. Again, week 1 is the week of January 24th. Clinicals is always on Wednesdays, and it's based on your clinical instructor, but it will tell you that they're roughly going to be anywhere from 6 in the morning until 6:30 at night. It will not take all that long. It will not take all day long, but I have to tell you that you have to be able to keep that time open just in case something runs over, or if your clinical instructor says, hey, let's meet on week 3 and let's meet at noon and we'll be done by 6. It could happen. It's really up to them as far as they do it, as long as we cover the material. So for clinical replacement calendar, week 1, which is January 24th, which again is the Sunday, Wednesday is your clinical replacement day. You're going to actually cover the renal medications. Those renal medications are actually found in Canvas under the renal section of your lecture stuff. And if I pull it up, let's see here. So if you actually go to your Canvas course and you go all the way down to, let's see here, here's your lab, here's your med-surg case study. So if you actually go back to the actual clinical replacement calendar, it says that you actually are going to do renal medications and renal case studies. You're also going to do a VSIM, and you're also going to do the pre-test, post-test, VSIMs, and DocuCare. So if we start with step number 1, which is, let's see here, go down, there's your handouts, med-surg content. So if you actually go to your med-surg content, go to renal, right here is your renal medication list. I also had put up here a updated fillable medication sheet. Whether or not you want to use it, I can care less, but it just kind of helps you. Our idea in clinical replacement, going over the renal medications, you're going to literally fill out the entire page with everything you found in the book. As a nurse, we're teaching you what we know and what we concentrate on and what we're looking for, things that we're going to teach our patients. So that's what in clinical replacement we're going to do for the renal meds. When the other thing that was in clinical replacement for that day is also case studies. So if you actually go down, let's see here, and I lied, it's up here. And it's your med-surg case study. So you actually, eventually I'll publish this, but you'll click on the UTI case study, it will pop up, and basically it's a case study for you to fill out. During clinical replacement, we will then go over that question by question. We'll just literally discuss stuff. We'll fill in some blanks. We'll get you to think a little bit more deeper than what just the case study does. So, but this is something you actually will do prior to doing your first clinical replacement or any of the clinical replacements. Then as far as the VSIMs, you will find out that day which patient we're going to do VSIMs on. I do want you to get a 90% or higher on the pre-test VSIMs and the post-test. And then after that, on your own in the afternoon or evening, based on when your clinical instructor decides that they want to do it, you will do a docu-care and actually chart on the patient. So for week 2, same concept. GI medications, there's actually a GI medication list. You're going to go back to Canvas, go to the GI content. You'll find a GI medication list. You'll fill out the medication sheets. Prior to clinical replacement, you will go over them with your clinical instructor, and then basically they'll teach you what they want you to know and how to think about those meds and kind of go on. Case studies, again, there's a GI bleed case study, there's a pancreatitis case study. Those are also in your case study portion of Canvas. And then sometime during that day, you'll do another vSIMS on a GI patient, and they'll give you that name and it'll actually be set up for that. I can tell you that you can do all the vSIMs if you want to. They're not going to count as credit because of the fact that I've actually set it up based on date. I don't do that because I don't want you to like be able to get ahead and be able to do it and have more time. It's just that the renal medications, the renal case studies, and the vSIM, they tend to follow each other. They're following what I've taught you in lecture. They're following what we're doing in lab. They're following what we do in clinical replacement. GI, same way. We'll have a lecture with GI, we'll do a lab on GI, and then we'll do an actual vSIM and a clinical replacement day on GI. So there's a little method to my madness. On week 3, which is February 7th, on the Wednesday of that week, you will actually do insulin and heparin math. That is also found in Canvas, and it's actually found it is found under your Med Math resources. You will have 2 resources that you will need to do. One, there's a math practice packet, so definitely click on that, definitely work on it. That actually comes from your math book. All I really did is actually scan the pages, so definitely do those pages. We will go over it at some point based on making sure that you understand how we do it. There's also a math packet that you can go through as far as teaching you as far as rounding and the IV pumps and things like that. And then there's also your heparin insulin practice packet. That is something that we will actually go over in your clinical replacement day. There's also a neuro case study, men's health case study, and a cancer case study. The case studies take about an hour, hour and a half or so. So this might be a lighter day, but again, I don't want you scheduling work. I don't want you scheduling, not having a babysitter. This is the day where you are scheduled from 6 to 6:30. Whether you get done early, great. It's a wonderful surprise. Whether you stay for the entire day is really, you've already planned for it. On week 4, which is February 14th, that's your simulation day. We will actually be on campus for that day all day long, from probably roughly 6 or 7 until 6 or 7 at night. There is a pre-simulation, there's a simulation, and then there's a post-simulation. Essentially, it's almost like Day in the Ward that you guys did with Jerry. So it's not too far off, but we'll get more into details as that gets further on. So, and then basically week 1, 2, 3, and 4, that's actually after the flip. So when you guys go to OB, the next group comes to me, and it's pretty much the same calendar setup. And I think that might actually be it. So let's see here. We went over the lecture. See here. I noticed that they actually didn't put in the chapters for the content, but for the most part, if you actually go through your MedSurg, I think it's edition 14th or whatever, if you actually go through it, go through the index, basically you're reading everything from, the first chapter of renal, which is probably more of the patho, going through all of it. You're going to be like, well, what do I need to know? You need to really know all of it. The idea is the content in the chapters are fair game. I actually kind of break it down more into what I want you to know, what you need to know, how I actually practice, and what I see at the bedside. I put those in the PowerPoints and the voiceovers, and do the lecture on that stuff. So I know it's a lot of reading, but I mean, I can't. If I gave you specific pages of what I want you to know, you would only read them and you would really miss a lot of content. And there's a lot of things that are very interactive. So I don't do a lot of patho teaching. So if you are not real good with patho, definitely read that chapter so you understand more about what the kidneys do, how they work, what you're expecting them to do, what the problems are, and then really go through the disease processes. Same thing with GI, same thing with neuro, same thing with endo, men's health, hematology, cancer. Really just find them in the book, read the chapters, definitely do the patho, and we'll go from there. So if you have any questions, let me know. Thank you very much.